Welcome to our educational video about eosinophilic cystitis, a rare inflammatory condition affecting the bladder. In this video, we'll explore the causes, symptoms, diagnosis, and treatment options for this intriguing disease. The exact cause of eosinophilic cystitis is often unknown, classifying it as idiopathic in many cases. However, several factors are believed to contribute to its development. These include allergic reactions, parasitic infections such as schistosomiasis, certain medications, bladder trauma or surgery, and even bladder cancers in rare cases. These triggers lead to an inflammatory response in the bladder wall. Eosinophilic cystitis is characterized by an abnormal accumulation of eosinophils, a type of white blood cell, in the bladder wall. These eosinophils release inflammatory substances that damage the bladder tissue. This inflammation leads to thickening of the bladder wall, decreased bladder capacity, and various urinary symptoms. The specific mechanisms that trigger this eosinophilic infiltration are still being investigated. Eosinophilic cystitis is a relatively rare disease, and accurate data on its prevalence and incidence are limited. It can affect individuals of all ages, but it appears to be more common in children and young adults. Some studies suggest a slightly higher incidence in males compared to females, but further research is needed to confirm this. The symptoms of eosinophilic cystitis can vary depending on the severity and extent of bladder involvement. Common symptoms include frequent urination, urgency to urinate, painful urination, blood in the urine, and pelvic pain. In some cases, patients may experience urinary incontinence or difficulty emptying the bladder completely. Children may present with irritability and bedwetting. Diagnosing eosinophilic cystitis requires a thorough evaluation, including a detailed medical history and physical examination. Urine tests are performed to rule out infections and identify blood or eosinophils. Cystoscopy, a procedure where a thin tube with a camera is inserted into the bladder, allows visualization of the bladder lining and collection of tissue biopsies. Histological examination of the biopsy samples confirms the presence of eosinophils and other inflammatory cells in the bladder wall, which is crucial for diagnosis. Imaging studies like CT scans or MRIs can help rule out other conditions and assess the extent of bladder involvement. Eosinophilic cystitis is often classified based on the pattern of infiltration and severity. The most common types are diffuse, where the inflammation affects a large portion of the bladder, and localized, where the inflammation is concentrated in a specific area, often forming a mass, like lesion. In some cases, the disease can be ulcerated, with open sores forming in the bladder wall. The treatment of eosinophilic cystitis aims to reduce inflammation and alleviate symptoms. The initial approach often involves conservative measures, such as avoiding potential allergens or irritants. Medications including corticosteroids, antihistamines, and mast cell stabilizers are commonly used to suppress the immune response and reduce eosinophil activity. In severe cases, surgical interventions, such as transurethral resection of bladder lesions or partial cystectomy, may be necessary to remove affected tissue or increase bladder capacity. Intravesical therapies, where medications are instilled directly into the bladder, are also used in some cases. Currently, there are no specific preventative measures for eosinophilic cystitis, especially in cases where the cause is unknown. However, identifying and avoiding potential triggers, such as allergens or medications, may help reduce the risk of recurrence in some individuals. Maintaining good urinary hygiene and promptly treating any urinary tract infections may also be beneficial. The prognosis for eosinophilic cystitis varies depending on the severity of the disease, the underlying cause, and the response to treatment. In many cases, symptoms can be effectively managed with medication and conservative measures. However, recurrence is possible, and long-term follow-up is often necessary. Recent research is focused on identifying specific biomarkers and developing targeted therapies to improve treatment outcomes and prevent recurrence. Studies are also investigating the role of genetic factors and environmental exposures in the development of eosinophilic cystitis.